So many of you in the room, and almost probably all of you, know about radiation therapy and its effects in the head and neck space, but it is a very commonly used oncologic therapy. And as radiation oncologists, we always say about 2/3 of cancer patients need some form of radiotherapy at some point in their cancer journey. However, there are many different forms of radiation therapy, and one of the easiest ways to recognize the difference between them is they are very different sizes and very different scales, and delivered in very different ways sometimes. On the far left, you see maybe one of the oldest and arguably the oldest form of radiotherapy and brachytherapy, which is taking something radioactive, putting it close to the tumor, and then taking it away, but giving a dose by being close to it, or planting seeds that are radioactive or something like that. The second, you can see our now former US president standing next to a linear accelerator. This is a radiation device that probably many of you are familiar with, and it's the most common type of radiation therapy that patients experience worldwide, and this delivers X-ray or photon-based radiotherapy. And on the far right, you see a proton therapy machine. And the difference in scale is immediately visible in the room, but behind the room, it's even more visible. I'm sure from afar that may not project as well, but what you can see is both in the room at the top as well as outside the room, or behind the room, I should say, for the proton therapy device that we have in London. And you can see a tiny little blue shirt, probably on a human, standing on that bottom left panel. The gantries that deliver proton therapy in London at UCL, and in conjunction with our private service at Proton International London, are 300-ton gantries that rotate 360 degrees around a patient. They take a subatomic particle at 2/3 the speed of light, shoot them up a surrounding building, back down a surrounding building, and land it on a patient within a 2 to 3 millimeter space, thousands of times in milliseconds. It's a lot of hardware, it's a lot of time and cost to build one of these, but they deliver radiotherapy much like patients experience with X-ray based radiation. It's a daily treatment, Monday through Friday in general, for head and neck cancer patients. It may take 30 minutes instead of 20 or so on average for a head and neck cancer patient, but they do require this beating heart on the left, which is a gigantic 90-ton cyclotron about the size of 2 motor vehicles, that helps accelerate the proton to 2/3 the speed of light before it comes out of the machine.